Welcome to today's webinar where we'll be talking about the NIHR Global Health Research themed programme and our current open funding opportunity, which is tackling antimicrobial resistance in sub-Saharan Africa and South Asia. So we have a few presenters today. We have our Programme Director, Cara Hansen. We have Sarah Pudcombe, who's our Assistant Director, Ina Walker, who's Consultant Advisor, Faye Havens, who's myself, is a Senior Research Manager, and we also have people managing for the Q&A. We have Lisa Marsh, a Senior Research Manager, and Natalia Edwards, who is our Senior Finance Manager. And we also have webinar support here today with Lewis Bradley. Next slide, please. So throughout this presentation, we're going to cover the overall global health portfolio, the Global Health Research theme call and about that themed programme, what makes a good application, the application process, and then we'll have our questions and answer session. So I'm now going to hand over to Cara Hansen for her first part of the presentation.
Good day, everyone. It is a real pleasure to be with you here today for this webinar about our upcoming NIHR Global Health Research themed call. So I am the Program Director for Global Health at the NIHR Global Health Research Program. So the National Institute of Health and Social Care Research in the United Kingdom has the mission of improving the health and wealth of the nation through research. In 2016, an element of global health research was added to our portfolio, the icon there on the far right, and this was enabled through an allocation of official development assistance funding to the Department of Health and Social Care. So we use this funding to fund research and capacity strengthening through four different channels. Three are channels that we administer ourselves. So there are global health research professorships and advanced fellowships. These are individual awards. These are all also open now, so I would refer you to other NIHR information pages to find out more about these. We fund through our annual thematic call that addresses a specific priority area each year. And we also fund through partnerships that we have with other research funders to leverage the budgets and expertise of co-funding to be able to address strategic priorities, increase our reach and impact, and act quickly in health crises. So to date, I'm very pleased to share with you what our portfolio looks like since 2016. So we've committed over £734 million since 2016. We have 163 active awards and 90 awards that have been completed since 2016. We have a large number of trainees. These are individuals who are associated with NIHR research programs and who are involved in the training and capacity strengthening activities of the NIHR Academy. So we use these funding from official development assistance to support research and build research capacity to prevent, detect, and respond to global health security threats and challenges, improving the ability of health systems to protect the health of the poorest and most vulnerable, including women, newborns, children, and adolescents. We fund themed research and individual capacity strengthening, and primarily through applied research. This includes later stage and applied research that develops and evaluates innovations, including through clinical trials, research that supports health systems to prevent and respond to health security threats. And we also look to our research to have strong elements of implementation and multidisciplinarity, because we believe that implementation research and the insights of multiple disciplines are really important to ensure that robust findings can then be scaled and used to have broader impact. So the NIHR works on these principles of the 4 I's: impact, inclusion, innovation, and investment. And I'm sure you'll hear more about it's particularly about impact and inclusion during this webinar. And we work through these operating principles here on the right of particularly of equitable partnerships and of community engagement and involvement. At the moment, our geographic priorities are countries of low and middle income in sub-Saharan Africa and South Asia. I'll now hand on to Sarah Puddicombe to take us through some of the details of the themed research program.
Thank you, Cara. If I could have the next slide, please. So what is our Global Health themed programme? It really is about funding applied health research that can prevent, detect and respond to key global health security challenges and threats, particularly focused on research within low and middle income countries within our priority areas of sub-Saharan Africa and South Asia. Now, as Cara mentioned, the programme is really focused on promoting equitable partnerships, embedding community engagement and involvement, and strengthening research capacity. And by having this cohesive approach, we really hope to support multidisciplinary teams to drive impactful research. Now, the research that we're looking to support can be clinical, social, behavioural, economic, or systems research, but it has to target and focus on prevention, detection and treatment of infectious diseases. And you'll hear more about this being focused on AMR. We're looking to be able to reduce disease burden and ultimately improve health outcomes, particularly for the poorest and most vulnerable populations living in LMIC countries. And by doing this, we really feel that we can drive improvements in practice, inform policy, and really sort of drive sustained benefits for health outcomes in those areas. Next slide, please. So who are we targeting? Well, we're looking at equitable partnerships between researchers and institutions. Those lead researchers have to be based in either sub-Saharan Africa or South Asia, and can be between two LMIC countries or between one of those LMIC countries and a UK partner. But those countries, as I said, have to be within official development assistance supported sub-Saharan Africa or South Asia. We're supporting multidisciplinary teams for high quality applied research, and we're really looking at improving those health outcomes. We're going to run a call every year, and the theme will change every year. So this year we're talking about AMR, next year it'll be a different theme. Within that, we will offer 3 funding bands, and the range is from £500,000 to £5 million across between 3 and 5 years. And these bands are designed to be able to support those who may be more new to global health research, right the way through to very experienced teams and partnerships. Next slide, please. So the theme that we've chosen this year is tackling bacterial and fungal antimicrobial resistance. Now, we know antimicrobial resistance is a major global health public health concern, and it's really impacting deaths worldwide. And actually, it's estimated to be growing to affect 30 million people by 2050. So this growing concern is a challenge across the globe, but particularly felt in low middle income countries where there are higher death rates. So due to this, NIHR have worked with various stakeholders and looked at available literature and identified that there's a real lack of evidence of real-world implementation of interventions, particularly that are designed to strengthen antimicrobial stewardship, prevent AMR infections, or improve AMR health-related outcomes. So we have launched this call. Can I have the next slide, please? The focus, as I've said, is on bacterial and fungal antimicrobial resistance, specifically those listed as WHO priority pathogens. For this call, however, we are excluding TB. Our aim is to generate evidence on these interventions that are able to reduce AMR in our priority countries, with an emphasis on our late phase evaluations and implementation studies, where the primary outcomes have to be relevant to human health. The interventions really have to have demonstrated efficacy in order to be eligible for this call. And we're looking for them to be practical, affordable, scalable, and sustainable. And as I said, we're looking for measurable reductions in AMR burden as a consequence of the research. So the research you're undertaking can focus on prevention. It can that might be through infection prevention control strategies, detection such as point of care tests, finding more effective treatments and available treatments for patients, and supporting antimicrobial diagnostic stewardship to improve detection and as well, we're looking at health systems strengthening. Can I have the next slide, please? So in terms of the scope, as I said, we're looking at WHO priority pathogens, both bacterial and fungal pathogens, but not TB. We're looking for interventions with very clear signals of efficacy so that you can focus on reducing AMR, or implementation of effective interventions or solutions where evidence may be needed to adapt them to different settings and support scale up and sustainability. As I said, we're looking for demonstrable effects on AMR endpoints, but you may wish to look at single clinical syndromes that are highly affected by AMR, or the implementation of new and improved methods, tests, or tools that can strengthen existing AMR surveillance systems, which are part of antimicrobial stewardship. The interventions are able to target environmental determinants of AMR, but please ensure that this is done as a part of a larger programme of work and that you have very clear human health outcomes. You can include things like strengthening health services, policies and systems. And we are, as I said, really keen to encourage you to think about AMR in vulnerable groups, particularly those of maternal and neonatal populations. But any sort of vulnerable group may be justified. Interactions of AMR infections with multimorbidity and aging are also in scope. When you're thinking about your application, though, please make sure that you're really able to demonstrate the demand from LMIC stakeholders and really strong links to local, regional, and national policies. And within your application, we would also be willing to consider any methodological elements that are included as part of a wider programme. There are far more details on our call guidance, so I please refer you to go and see that for more information. Next slide, please. So in terms of outer scope, please, TB is outer scope, viral or parasitic AMR are not in scope for this, as are pathogens who are not on the WHO priority pathogens list. We will also discourage you from trying to focus primarily on research that are really looking at social determinants of infection, such as malnutrition, or primarily focused on non-communicable diseases. Please do ensure that your interventions have clear proof of concept and are not focusing on efficacy and safety interventions at the earlier phases. We are really focused on later phase trials and implementation research, and that has to be on interventions with proven efficacy. We would like you to please make sure that there are clearly defined pathways to impact on AMR-related health outcomes, policy and practice. And that research really does focus, if it's focusing on AMR surveillance systems, that you're not developing new systems, rather that you're looking to improve and enhance existing surveillance systems. Next slide, please. In terms of eligibility, we will support lead applicants who are employed by eligible LMIC institutions based in sub-Saharan Africa or South Asia. Now, some of our schemes, you can be a sole lead, and for others, we require joint leads. So again, one can be from one of these LMIC institutions, another can be from another eligible LMIC institution or from the UK. That doesn't preclude you from working with other LMIC organisations out with sub-Saharan Africa or South Asia, where that is well justified and it supports your research. Next slide, please. This is a summary of the band characteristics that we're funding. And I think what I'd like you to take away is obviously there are bands that you need to decide which one you're going to target. And please then focus your attention on meeting the criteria to attain that. For example, we are going to be funding and supporting approximately 2 Band 1 awards, which go up to 5 million, approximately 4 Band 2 awards, and approximately 5 Band 3 awards. You'll see that the leadership model only accepts a sole lead at the lower Band 3. And there is an expectation for capacity strengthening across all of these bands, but the Band 3 again has the proportion of the budget targeting with capacity strengthening is proportionate to the size of the award. Any capacity strengthening that you're intending to include, please can you make sure that that will be concluded within the term of the award of the funding. Next slide, please. Now, the NIHR have introduced research inclusion as a condition of funding, and we did that in our domestic programmes over a year ago, and it is now coming to our global programmes. So this is new, and applications will now need to actively consider how you're going to consider potential health inequalities throughout the whole research life cycle. And we're encouraging you to really think about and cost for inclusive design components. To support you in this endeavour, we've got lots of really helpful guidance, which I'm pointing to here. There's a webinar that we've provided that you can watch, and a toolkit on equity and inclusion that really allows you to get a deeper dive into some of the considerations about equity and inclusion. And it covers topics such as budgeting for inclusion, equitable partnerships, and data collection. Next slide, please. When you're thinking about your proposal, please ensure that you're thinking about how it's going to meet the funding assessment criteria. These are within our core guidance. And at stage 1, or the outline stage, we are going to be looking exclusively at 1 to 5. And at stage 2, we'll be looking at all of these. But please don't ignore the fact in your outline application that we would like to see and understand what you're thinking about capacity strengthening, how you're going to approach community engagement and involvement, and demonstrated equity of your partnerships and considerations for value for money. So a nod to those, please, within your outline application. But I'm going to talk through in more detail the criteria that we'll be reviewing at the outline stage. Next slide, please. In terms of the relevance of your proposed research, please ensure that from the start, you're basing the research with a clear understanding of the local context and the health systems and available literature around the topic that you're proposing. We're looking to ensure that it's filling a significant gap and really does meet unmet health needs in those priority countries, and that you're aligned with the scope of this funding opportunity. And considerations of how individuals and research institutions can produce relevant, high-quality research that meets ODA eligible needs will be a priority for our committee. Next slide, please. We're also looking for research quality and excellence, so ensure that you have a robust plan, that there are really clear questions, objectives, and sound design, and as much detailed methodology as you can fit within the outline phase. We're really looking to make sure that you have clear milestones and that you've thought about and identified possible risks and ethical considerations that need attention. Please don't ignore the fact that these are complex awards and that you will need effective programme management, governance, institutional support and contract management to be considered as part of the delivery of your programme. Next slide, please. The strengths of the team we've talked about already. We're looking for multidisciplinary teams with a really broad and appropriate range of expertise, and something that really demonstrates that you are going to be promoting interdisciplinary research working, and that you will be considering and providing mentoring arrangements and support where you have more inexperienced researchers who you're developing research capacity for. Next slide, please. In terms of impact and sustainability, this is a strong theme for us, and we're really looking for you to be able to demonstrate how those research outputs will achieve impact. How will they improve practice? How will they inform policy and support future implementation and sustainability of your partnerships beyond the end of the funding, and have sustained impact in improving health outcomes? So consider having a clear and implementable strategy to achieve impact and research uptake and dissemination. Next slide, please. In terms of inclusive research, we are looking for really justified, clear justification of how your research will address the gaps in health and care needs and inequalities, and that you've really carefully considered and included marginalised and vulnerable individuals and communities. Think about how you're considering inclusion when you're looking at your target sample, and what the inclusion and exclusion criteria are, and things like your approach to recruitment and retention strategies. There are other things that we'll expect you to consider in your full application, such as collection of demographic data, considerations in terms of the methods that you're selecting, and ensuring that you have an equity lens in terms of statistical analysis and perhaps disaggregation of the findings. But do also consider how inclusion could be built into your knowledge mobilisation and dissemination plans. Next slide, please. In terms of finance, at the outline stage, we really only require an overall cost for your proposed project. Please make sure that it's fitting with the band that you're applying to. Obviously, we have a broad range, so ensure that that fits within the duration and the funding limits for the band that you're selecting. The committee are very keen to ensure that the balance and flow of funds is very clear, and that the benefits are seen where the majority of the work is undertaken, ideally within LMICs. And if that's not the case, please ensure that you justify how the funding will directly benefit the LMICs that you're working with. We have very detailed guidance, and I'd like to refer you to that for more finance guidance. So I think that's it for me, and I will hand you over to Ina, who's going to give you some tips on what makes a really good application. And good luck. Thank you.
Thank you, Sarah. Hello, everyone. It's a pleasure to be talking to you here today. I'm a consultant in public health medicine and a consultant advisor at NIHR, including the Global Health Research Programme. Today, I'll be discussing what makes a strong outline application. The points I'll cover are based on observations from myself and colleagues who support funding committees as consultant advisors. Over several years, we have been able to observe committee discussions and identify common themes in successful and less successful applications. The aim today is to help you understand what committees are looking for at this stage and some of the common pitfalls to avoid. Next slide, please. So this is a very abridged diagram of our two-stage application process, and you will learn more about the process in the next part of our webinar. So applications first go through an outline assessment, stage 1, where committees consider the overall strength and potential of the proposal, and applications that are shortlisted are then invited to submit a more detailed full application. And at the next stage, applicants are usually expected to address committee feedback from the outline stage and provides substantially more detail across the assessment criteria. Next slide, please. So my part of the talk will be structured in 4 parts. And first, I'll discuss selling the idea, or how to convince the committee that the research is important and timely. Second, I'll talk about selling the methodology, demonstrating that the research is feasible, rigorous, and appropriately designed. And then I'll cover some common challenges and issues that committees frequently identify in applications. And finally, I'll mention the use of AI in applications. Some of the points may echo those already mentioned by Sarah, and the reason is that these are the features that we see again and again in applications, which can either elevate or undermine individual applications. Next, please. So one of the most important aspects of an outline application is clearly communicating why this research is important, why it matters, and why it matters now. So applications need a clear story, clear narrative, and a convincing rationale. Committees want to understand the problem that you're addressing, and very importantly, why it's important in that setting, and why your proposed work is needed at this point in time. So all of those components. Claims need to be justified with evidence. So this might include published literature, preliminary data, or your previous work conducted by your team. So unsupported assertions are not likely to be persuasive at this stage. So applications should also demonstrate that the research will benefit people in the local setting. I know we are looking for the wider impact as well, but committees are looking for work that addresses locally relevant priorities and have a realistic pathway to wider impact. At the same time, it's helpful to consider whether findings may also have relevance beyond the immediate context. This could be beyond the region, in other low and middle income countries, or even high income countries. All of this is relevant, and that's your chance to demonstrate it. So why is your team well placed to do this research? This is your chance to show this. So you need to show that you have the right expertise, that the team collectively has expertise, skills, and experience to deliver the project successfully. And I'll mention a little bit more about this in one of the next slides. Next slide, please. So it's important to present a good case, but it's also important to avoid overstating. So, for example, overclaiming that what the project might achieve in the time available, or presenting the research that you think will solve the very broad or very complex problems by itself. So committees will be aware that there are many competing health and healthcare priorities and issues, and the research impact is often incremental and can take a long time to come through. So we advise a measured and evidence-based approach, which will make it sound a little bit more credible. It's also important to demonstrate awareness of the wider field. So applicants should show that they understand what research has been going on, what work is ongoing right now, and where the true gaps remain. So if you leave out important programs or current studies, this can undermine confidence in the application and raise concerns about the team's engagement within the field. Next, please. So the methodology is another area that committees look at very carefully. At stage 1, committees recognize that every methodological detail may not yet be fully finalized. That's understandable, particularly where further engagement or further work is still needed. However, applicants still need to demonstrate that there is a coherent and credible plan for conducting the research and that there's a clear process for refining methods where necessary. So committees will also want to understand why a particular methodological approach has been chosen. This justification is very important. And they could, again, come from existing literature, previous experience of the team, your own pilot work, or community engagement activities that may have informed the design of your study. Next, please. So community engagement and involvement are particularly important within the Global Health Research Programme. And committees want to see that communities, stakeholders will be meaningfully involved in shaping and informing the research, and that the work is designed in a way that's appropriate and beneficial to the local context, as already mentioned. And this should be longitudinal, so not just at the very beginning when you're designing your study, but you should demonstrate how this involvement will continue throughout your project. So applications should also consider sustainability and longer-term impact, as Sarah already mentioned, beyond the immediate lifetime of the project. And another major consideration in global health research is capacity building. So committees often look very closely at who is doing the work and where the expertise is located. And generally, there is a preference for expertise to be based within low and middle income country settings wherever possible, as well as leadership. But sometimes we see substantial involvement from high income partners. And where that's the case, it should be clearly explained why those particular skills are needed and particular roles, and how this collaboration will contribute to strengthening research capacity in low and middle income countries still. Next, please. So now I'm going to cover some of the common challenges that committees frequently identify, and you will see they mirror a little bit some of the good examples of practice. So the first is lack of detail. So applicants often face this difficult balance between staying within the word count while still providing enough information across all sections. And one common issue is insufficient detail on methodology. Even if the methods are still evolving, the application needs to show that there is a clear, achievable plan or a path. It's important to use the word count efficiently, which can be tricky. Try and avoid repeating the same information too much, because that can, of course, reduce the space available for important information that might be otherwise omitted. Another common challenge that we see is failing to justify statements. So once again, committees are looking for evidence-based arguments and assertions throughout the application, and without supporting evidence, statements become just opinion and become less convincing. Next, please. So another issue is insufficient demonstration of knowledge of the field or of the methods. So, for example, once again, applications may overlook important existing research, or the methodological descriptions may be unclear or inconsistent throughout the application. So sometimes committees see applications where there are multiple methodological approaches, but without a clear explanation of how they fit together and which approaches will ultimately be used. So this can create uncertainty about the feasibility and good planning and coherence of the project. It's also important to remember that some committee members may be specialists in your field, and any gaps or inconsistencies can be particularly noticeable. So a further challenge is to do with the team balance. So applications need to demonstrate that the teams include the appropriate expertise across all key disciplines, that and also that the partnerships are equitable and appropriately structured geographically. So, for example, if you're including a health economics component, of course, you need to have a health economist input into the team, or if it's qualitative work, who's your qualitative expert? So things like that. Next, please. So impact and sustainability, both cannot be emphasized enough. So applications should very clearly explain what benefits the research is expected to generate. And in particular, beyond academia, if you can demonstrate that, that can be very helpful. And whether those benefits are likely to continue after the funding period ends. Again, that's linked to the sustainability aspect. Finally, on topic of the language. So language and clarity are very, very important. So committees may include experts in your field, but also they will include non-experts and possibly members from all sorts of backgrounds, including lay members. And applications need to be understandable to a broad audience. So avoid excessive jargon and explain technical terminology where that's applicable. And the aim is to communicate clearly in plain English exactly. You have to be able to explain exactly what the research will achieve and why it matters, and that should be very easy to understand to a non-expert. So one useful strategy would be to ask maybe colleagues outside your field or lay friends or members of your family to read sections of your application for clarity. Next, please. Yes, so the elephant in the room, the use of AI. In 2023, 8 funding bodies in the UK, including NIHR, came together and produced a statement on the use of AI. And this particular quote on the screen refers to the use of AI in funding applications. So if generative AI is used in other contexts, such as preparing funding applications, it must be clearly cited and acknowledged. So we all know that AI can be very useful in research in all sorts of ways. It could help you tell a better story, perhaps, tidy up some of the language, etc., etc. And of course, we know that there are pitfalls. There are what we call hallucinations, whereby the model imagines facts, but very confidently presents them to you. So that information could be inaccurate or false. It could misrepresent data and evidence and package it in the wrong way. Or it could misalign. So if you ask AI for one thing, it could actually take you off on another tangent. And we've all seen that if you've got any experience with AI. There are also ethical concerns, such as who is ultimately the author if much of the writing is done by AI, as well as misrepresentation, or rather insufficient presentation of vulnerable and less vocal groups, because AI works with what's available on the internet and goes with the majority usually. And there are sustainability aspects. So all in all, if you use AI, our message would be view it as an assistive tool. Scrutinize very, very carefully what you get from it. Double check every fact. Retain overall control of the output, oversight, and exercise full transparency. You have to declare the use of AI. This is it from me, and I'll now hand over to Faye, who will talk in more detail about the application process, and very best of luck with the applications.
Thank you, Ina. So welcome again, and thank you for joining us today. I'm going to talk through the application process and give you some hints and tips to ensure that the submission process is as easy as it possibly can be. Next slide, please. So, as has already been mentioned, the Global Health themed funding opportunity will be a two-stage application process. So, stage one is a shorter outline of your proposed research plan, and Inna has done a great job explaining how to ensure this has all the information that we require. Your application will be assessed in the following way. It will go through eligibility and remit checks. These are carried out to ensure that your application meets the criteria set out in the guidance and is eligible for the themed programme. We also look at the eligibility of your contracting organisations, so please ensure that you've checked against the published criteria. Applications will then undergo a triage stage. This is carried out by the funding committee to manage the high numbers of applications we receive. We expect this funding opportunity to be particularly large, so please bear this in mind. Any applications that are declined at the triage stage will receive feedback. Applications then undergo review by the outline funding committee. Applications will be discussed to decide which ones will go forward to submit a full application. As mentioned, all applications that are declined or shortlisted will receive feedback. If you are declined, this feedback is designed to be constructive to help you with future applications. And if you're shortlisted, this will help you with things that you need to consider when you're submitting your full application. Once submitted, full applications undergo further external peer review, and applicants are given the opportunity to respond to these comments before their applications are then seen by the funding committee. Next slide, please. So this slide gives a more visual guide to what happens to your applications and when. So obviously the funding opportunity is already open, and we're having our briefing event here today. So the next milestone is the call deadline on the 8th of July. So all the themed funding opportunities close at 1 p.m. and that is 1 p.m. UK time. As you can see, you should hear outcomes from your outline submission in around about October. And if you're successful, July, sorry. And if you're successful, then your full submission would be due in December. So please ensure you have time scheduled in diaries to complete these submissions if needed. We'll then expect any successful project to start before January in 28. So next slide. So the most important piece of advice I can give you when you're applying for any of our funding opportunities is take the time to read the guidance in full. We spend a lot of time ensuring that as much information as possible is within these documents, and they are there to help you. And I can't stress enough how important these documents are. So please make sure you do read the guidance. You'll hear me say this a lot, but I would say about 99% of the queries that we receive, the answers are already in the guidance. There are a lot of documents to read, and it will take a bit of time. So I'm going to try and break down what we have and what it will tell you. So we have the scope and how to apply. So this is specific for this funding opportunity, and it will give you the scope of the funding opportunity, the eligibility and selection criteria, and set out the timelines. The core guidance applies to all global health calls run by NIHR, and we keep this regularly updated. So even if you have read this before, it's worth taking another look. We have the application form guidance, and this tells you what to put in what section of the form, how to complete the form within the application management system. We have got a new application management system, so this is worth having a look, as the system is quite similar to our last one, but it is different, so these will help you navigate through. We have finance guidance, as has already been mentioned, which will help you complete your finance sections at full application, but they are important outlined to ensure that the figures you're putting in for your projects are realistic and include everything that you need. And we also have a Word version of the application form, so you can see what you need to include. And you can see things like character counts and section headings. And this means you don't need to log into the system just to look at the form. You can have a look straight there. It is important to note that this is not a valid application form and can't be submitted, and only applications that are received through the awards management system will be considered. Next slide, please. So we've mentioned already about inclusive research as now being a condition of funding. So we've got a lot of detailed information about inclusive research. As I say, this is now a condition of funding for global health applications. So it is important that you read and understand this guidance and understand the requirements of this funding assessment criteria. So next slide. So I'm not going to go through this slide, but this gives you a very brief overview of where you can find information within the different guidance documents. We are going to circulate these slides afterwards, so I'll let you read this in your own time, and I'm not going to try and go through it now. Next slide. So as I've already mentioned, you must submit your application via the Awards Management System, or AMS as we like to call it. The AMS will close at 1 p.m. on the deadline date. This is UK time, don't forget again. Late applications will not be accepted. If you're experiencing issues with the AMS or you're having any other technical problems, you must tell us in good time. We are not able to help you with 2 minutes to go before the deadline, so please don't leave it until the last minute to submit. It's important to note that there is only one mandatory upload, which is your references, and this is limited to a single page. If you include other uploads in your application, we will remove these before any assessment takes place. So please don't include information that you would like to be part of your application assessment as an upload, because it will not go through to any assessment body. Next slide, please. So these awards require different leadership models depending on which band you're applying for. And it's either a sole LMIC lead or joint leads, which could be one for an LMIC and one from another LMIC, or one from an LMIC and one from a UK. Only one of the leads will be the contract holder, and they will be responsible for the submission on the AMS. It's important to note that only they will be able to press submit on the application. Both joint leads will need to register on the system and complete tasks, but only the contract holder can submit. You can also add the names of your co-applicants at this stage, and all the co-applicants will be required to register and complete their tasks on AMS. You will not be able to submit your application until all the co-applicant tasks have been completed. This can be the most problematic part of the application process, so it's good to give people an idea that you're going to be adding them to the application and let them know that they will be required to do a task and complete things like their profile in their application management system. Collaborators can be included in your research plans as well, but they don't need to be entered into the AMS system. Next slide, please. So some top tips for success. My first and most important tip is once again to read the guidance. Once you've read this, you will have a clear picture of what's expected from applications. You must ensure that you meet the eligibility and remit criteria in full and give a clear and full explanation of the research you wish to do and how you will complete it. You should include how this will be impactful and how it will make a difference. You must make it clear how you've worked with your whole team, how you've engaged with the joint lead, the co-applicants, and what input the local community voices have had. Make sure that you've engaged people like finance and your institution to ensure you have the right support and infrastructure in place. Next slide. It's important to note that outline applications are short, so you need to be mindful of the space that you have and make your application concise and to the point. Don't have too many partners. You will have to be clear about how each is involved. And if you're successful, you will need to ensure you have things like collaboration agreements in place with each of these. Make sure that you write in plain English. All the committees and reviewers of applications come from all backgrounds and all countries, and they may not have English as their first language, so they need to understand your application easily. You should make sure that you are clear about how your proposed study builds on anything that you've done previously, and you should also be clear about how this differs and what aspects are new. You should include mentoring and support packages to help develop new leaders and new leadership models. If your application is a resubmission, so this would be if you'd submitted it to a previous global health call but were rejected at any stage, then please make sure you take into account any of the feedback that you've received previously. Make sure that the leads and co-applicants have registered on the application management system and completed their associated tasks, such as their personal profiles and ORCID registrations in good time. People not completing these tasks causes the most issues when it comes to the submission deadline. So if you see an AMS task pop into your homepage, please get it done. And I just wanted to clarify about ORCID. Now, this is a unique identifier that stores automatic links to all of your research. And this will now replace your CV in your applications. So it's important that you ensure your ORCID is well populated and includes all your recent research. And make sure that you submit on time. Don't leave things to the last minute. 1 p.m. is the deadline. It's UK time. The system closes automatically and we can't extend it. So if your application is late, we won't be able to accept it. Next slide, please. We are also currently recruiting for committee members to join our application assessment team. So if you think you would have the skills to join one of our committees, please do apply. Our committees tend to meet twice a year, once remotely and once face-to-face in the UK. And our members find these meetings very rewarding and we would love to welcome people to our team. So please do apply and the link is there when you get the slides. The application window is open till the 26th of May, so there's still a bit of time to get your applications in. So next slide. And next slide, please. So let's go through your application submission checklist. So have you got a clear application that meets the core specification set out in the guidance? Have you ensured you've met the eligibility criteria? Have you taken into account the advertised selection criteria? Have you included all the required uploads and not anything that isn't requested? Because again, we will remove this before committee assessment. And if you have any questions, please do contact us. Next slide. So in conclusion, make sure you read the guidance in full. Yes, it's long and there's lots of it, but I promise it's all useful. Make sure all the leads are registered on AMS and on ORCID. Ensure your team have completed their profiles and associated tasks, and the system will let you know if they haven't done it. So it's up to the joint leads to check that these have been done. Don't miss the deadline. The AMS will close. It's 1 p.m. UK time. We can't change this. Late submissions will not be accepted, so don't leave it to the last minute. And finally, good luck with your application.